part, like.
So I am private on my TikTok because I don't want anyone to know what I watch.
Hi, everyone. Thanks for joining us this afternoon. Looks like we're going to have a great crowd talk about preschool development. Just as a reminder, you are on your own for muting yourself when you come into the room. You don't come in muted. Just take a moment and hit the mute button if you're still wrapping up other items. We're going to just give it 1 second while everyone gets on audio before we get started. Okay, we're going to go ahead and jump right in. My name is Gina Capito, and with Danielle Fuentes Johnson and Lynette Demas, we lead Build's family childcare work or home-based childcare support work. And we are excited to offer today's webinar where we're going to focus more on unpacking the current opportunity under preschool development grants and ways in which it can be really tailored and more responsive to family childcare. So we have several guest speakers joining us to unpack this important concept and opportunity with a little bit more detail. Before we jump into that, though, as always, we want to take a quick opportunity to hear a little bit from you. So we're going to do a poll, and with that poll, we just want to know who's here with us, what parts of the field you represent. So if we can go ahead to the next slide, as well as bring up the poll. You should see the slide, the poll on your screen if you don't see the slide yet. And the options are obviously which element of the home-based sector that you represent. If you're an educator, provider, work at a support organization, this will certainly help our guest speakers to think a little bit about their content too.
Maybe two and keep that model and
All right, well, it looks like we've got almost everybody, a couple of folks still participating, and we have more than 50% of you are representing support organizations, so coaching, training, technical assistance, or regulatory groups. And then next is system administrators, so folks that are supporting the administration of childcare and other systems that support family childcare programs. I still see a couple. Yep, don't hesitate to go ahead and put in the chat what if you are not in there, right in there. So I see there's a student attending the webinar, which we're happy to have you. I'm going to end the poll because it looks like we've got.
I see it right here. I know it. Why do you have to?
Okay. So you should be able to see the results on the screen as well. Okay, let's hop back to the agenda slide so we can help kind of orient everyone to what we're doing at this webinar. Thanks, there we are. So we are going to focus on the preschool development grants. We're going to do a quick overview of them. And then we're going to talk in much more detail about how these apply to home-based childcare and share all kinds of resources to support you in that. We're thrilled to have partners from Homegrown joining us, as well as a few other speakers that are steeped in this work in their local states and communities. So hopefully it'll be a really rich consideration of how we leverage a funding stream, but also how we really think intentionally about supports for home-based childcare settings. One thing, just a couple pieces of housekeeping. We're not going to do as much on the sort of core beliefs and all of those things that we talk about typically at the outset of our national webinars, but I do want to do a quick reminder that we frequently move in and out of the terms home-based childcare, family childcare, even license exempt or FFN. We very intentionally move in and out of the terms because we know that within states systems, there's a lot of different use of the terminology, and we want to be inclusive of all the different ways in which family childcare, home-based childcare is delivered. So we are not making a statement alone with a term, but trying to be inclusive of the fact that across the country, there's lots of different ways that the terms are used, and we are not limited in who participates and benefits, hopefully, from the content at the different webinars and the technical assistance opportunities. We also want to reinforce that this particular discussion really does highlight or draw upon one of the core areas of the home-based work that Build supports, which is to think about how we leverage all opportunities, in particular funding opportunities, into supporting family childcare, and how we do so in a way that is really responsive to family childcare as a modality, the supports that it needs, and it's driven by those voices. And so that's those couple of our core beliefs are really coming together as we think about the implementation of the preschool development grants at this point in time. So before I turn it over to Natalie Renew with Homegrown, I'm just going to do a very quick overview of the opportunity. So in case this is something that you haven't heard anything about yet, you're aware of the fact that if we go to the next couple slides, well, there's an overview of the preschool development grants. And what we find with that is that there is federal funding available right now. There are some specifications around what states are eligible for the 10 one-year planning grants versus the 3-year renewal grants. All of that you can find through one of the resource links, and that link happens to be right there on the slide as well, where I wasn't going to get into some of those specifics. The grant was released back in September, and it's due not that far away, really almost next week on November 7th. So likely your state is already working deeply on it, maybe even in the home stretch of it. And part of what we want to do with this opportunity is not just think about what's going in on the applications, but also how we are really marshaling ourselves and thinking about the advocacy that is needed for the implementation. When the states receive the dollars and start working on them, how do we ensure that that deep and intentional focus on family childcare is carried through? And so this isn't just about the application process. This is also about implementation. There's some just great best practices coming at you through this content that really applies into the future also. But this just gives you a sense of the fact that we have this great funding opportunity out there. And if we hop to the next slide, you see a couple of the big goal areas. The preschool development grants are not new. You may have heard of them before, and your state may have already received one over the course of the last few years. They are really focused on, especially in the last round, really being focused on systems and thinking about family access and thinking about multiple modalities of care. In this particular round, they're very focused on workforce. They're very focused on thinking about how is the field responding to what we have seen more acutely during the pandemic, and workforce issues being a significant one of those, access to care being one. And so ensuring that families have the access and be able to make the choice that supports what they need as a family. So the big goals of the grant may sound very similar to what they've been over the years, but there's definitely been some more refined focus through this particular one. And we will continue putting links to the different resources in the chat so that you can find out more specifics on the federal application process. But as I turn it over to Natalie, Natalie's going to give a little bit more context on that as well.
Awesome. Thank you so much, Gina. Hi, everybody. I'm really thrilled to be spending this time with you. As Gina mentioned, my name is Natalie Renew, and I'm the Executive Director of Homegrown. Homegrown is a national funders collaborative working to improve quality and access to home-based childcare. And our mission is explicitly inclusive of both licensed family childcare and licensed exempt family friend and neighbor care. We can go to the next slide. You know, as Gina mentioned, there's $266 million available to states. And, you know, this is an urgent moment. So, you know, I think really want to underscore that, we have not been successful in getting transformative childcare passed at the legislative level, but the administration continues to really think about how to ensure that states have funding necessary to create systems change, and this is an important opportunity. So we hope that leaders are really thinking about how best to use this opportunity. And we want to encourage those leaders and you on this call to really consider how to prioritize home-based childcare in your response to PDG and in your ongoing work. And really, the reason that we believe home-based childcare should be prioritized is because it is a highly used and highly demanded form of care. We know that this is the largest source of non-parental child care, and that this is also the most likely child care arrangement for very young kids. This is also sort of a critical kind of equity issue. You will see throughout the application the underscoring of the need to serve underserved and diverse communities. And a really key strategy to do that is to include both licensed and license-exempt home-based providers, because this is where we know children from low-income backgrounds, Black and Latinx children, children living in rural areas, those with special needs, those whose parents work non-traditional hours, and those from immigrant and dual language learner households are most likely to be served. I will also say that I think, the inclusion of home-based childcare is really critical as an opportunity for states to leverage existing facility infrastructure and an existing really committed workforce. And is also a really important sort of piece of what we think of when we think about a diverse and well-funded mixed delivery system. So we think there are lots of really good reasons why states should be focusing on home-based childcare as they think about their PDG response. We can go to the next slide. Homegrown has prepared a resource for states as they're thinking about writing this application. Hopefully they're deep into writing this application. We're going to drop a link to this brief in the chat and really talk through the key components. But this brief really offers some background on, how states might use this opportunity, how, supporting home-based childcare providers through key strategies that we're going to discuss today, advance the goals of ACS. And then we share a lot of different examples, in the paper, and we're going to discuss several of those today on this call. We can go to the next slide, please. Specifically today, we are going to talk about the opportunities to reach underserved children and families in home-based childcare by developing or strengthening comprehensive networks of support for home-based childcare providers, by strengthening family, friend, and neighbor providers through home visiting services, and by incorporating home-based childcare providers in state-funded pre-K systems. You can go to the next slide. To do that, I'm joined by some super knowledgeable colleagues from around the country that are going to share some of their thinking and examples from their contexts that I think really can bring to life these ideas. So we are joined today by Joan Blau, who's the Senior Director of the Child Care Innovation Fund at the Early Childhood Investment Corporation in Michigan. We are joined by Heather Tridden, who is the Executive Director of Parent Possible in Colorado. And we are also joined by my colleague, Alexandra Patterson, who is the Director of Policy and Strategy at Homegrown. So we can go to the next slide. So we're going to start out talking about this strategy of either creating or enhancing networks of support for home-based childcare. These networks are sometimes called staff family childcare networks, but in the Homegrown application, we see them as applicable to both licensed family childcare as well as informal home-based childcare options. We can go to the next slide. This slide really sort of outlines a strategy that ensures that locally based network hubs have adequate public policy and financing resources to ensure that they can deliver to providers and children quality supports, business and sustainability supports, comprehensive services, health, mental health, and disability supports, and also support the well-being and thriving of providers, ensuring that those individuals themselves have things like health insurance and access to paid leave. super important to this concept is that providers and families are able to inform policy. That's kind of these green arrows, and are also able to contribute to the governance of the network itself. We can go to the next slide. You know, there are lots of different ways that we talk about networks, and there are lots of partners, some of whom are on this call, that have concepts and work around the development of networks. And so I want to just kind of underscore a couple of key issues. One is that we see networks as infrastructure and not interventions, but really this connective tissue that connects the state to providers through trusted intermediaries and hubs that have capacity to do that, that can interact with providers in home languages, and that can really support the delivery of various resources, information, and financing to providers. We see this as kind of a critical infrastructure piece that enables other program access. So we're going to talk about, you know, networks now, but also see networks as key to implementing the other two strategies we're going to talk about, which is delivering home visiting services or integrating home-based childcare into pre-K. And then, you know, also that there are lots of different organizations that can really serve as those hubs. And so, you know, we think that the hubs of networks can be CCR&Rs and unions and associations and cooperatives and lots of other structures who have a mission orientation to support home-based childcare and adequate resources to get the job done. The last slide we can move to before I turn it over to Joan is just a preview of some work that we've been doing to really articulate what are the strategies and the indicators of networks that are being successful. And we really think about kind of why do networks do what they do, what is their mission to serve home-based providers, what do they do, how are they delivering those different services, and how do they do that? How are they using implementation science to be effective? And so encourage you to you know, take a look at this resource on our website. It's linked within the paper, and there are lots of other resources that hopefully can be helpful to you if this is a strategy that you're building out in your PDG plan. So with that, I'm going to invite Joan into the conversation and ask her to share a little bit about what her and her colleagues in Michigan are doing around building family childcare networks for the state.
Thanks, Natalie. Great to be with all of you today. Super excited to share a little bit about what we're doing in Michigan. So with some of the American Rescue Plan Act funds that the state of Michigan has received, it's decided that it wants to scale up family childcare networks. And the Early Childhood Investment Corporation won the opportunity to lead that work for Michigan. And so we are really imagining that what we're going to be doing is offering 3 types of grant opportunities to help with the scaling process. So first of all, we'll be offering design grants, and the purpose of those design grants will really be to support community-based, culturally responsive networks to be developed, and we'll be providing intensive technical assistance and a small planning grant. Our key goal with the use of these design grants is to really enable what Natalie was talking about maybe as cooperatives. I would take it even further and say provider-driven network development, so that we offer an opportunity perhaps for what we all have experienced, which are informal networks of family childcare providers, to become formalized and actually receive funding to support their efforts, as well as groups of family childcare providers who really never even imagined that they could have an opportunity to hire their own network administrator to support them. And we are going to be really using an equity lens and human-centered design practices to help groups of childcare providers and other organizations, as Natalie mentioned, put together design plans. And then we'll be offering a subsequent round of grant opportunities to actually fund the piloting of those designs. So once we've actually got a great portfolio of designs out there that are really aligned with what providers want and need and what research and the work that great organizations like Homegrown have been doing helps us understand would be most critical. In Michigan, we think that's going to be things like business supports, helping people get better connected to peers, and also some of the really what I think some people think of as like soft things, but what are super important to childcare providers, especially home-based childcare providers, is that their networks are going to be able to enable them to provide care in ways that are keeping with their cultural norms and the values they share with the families they serve. And so how are we helping folks who maybe really haven't had an opportunity in the past with our quality rating and improvement systems to really come together and think about how to improve their program quality, to feel as though this is a legitimate opportunity for them to do so. So these pilot grants will help to support piloting of family childcare networks. And then we are also going to be offering some scale up grants because we're confident that there is work happening across our state that might, as I said, still be informal, but might also be formal, but has only been funded with private dollars, to have an opportunity to actually receive public funds and more intensive support. For all of the grants that we fund at the Child Care Innovation Fund, we have a very robust wraparound technical assistance where we work with our grantees both individually, but also in learning communities, because we have found that that's one of the most important supports for them. So we're really looking forward to what we think is an exceptional opportunity to really scale these networks across the state. And one of the things that we're going to be doing across all of these grants is building shared buy-in around sustainability of these. So our goal is actually to sustain these networks after those ARPA funds end, and we'll be working with state policymakers and private foundations, hopefully major employers and others across the state that we know have influence on state policy. Hopefully also many family childcare providers themselves, to make the case for the importance of these networks, not only the ones that we're able to scale with the funding we receive, but to continue that work to design, pilot, and scale in response to what we hope will be a growth of family childcare across the state of Michigan as a result of these efforts.
Awesome. That's really exciting, and we're so thrilled to see Michigan really leading in this process. Joan, I wonder if you could reflect a little bit on kind of how Michigan got to this point of releasing this RFP, kind of what motivated it, and what were some of the steps that the state took to kind of set up for issuing this RFP and selecting partners like yourself to do this, and if there are any reflections that you might offer through that other states could consider as they think about how to lift something as significant as a statewide network initiative.
Those are such great questions. I will say that this is something that our agents, the Michigan Department of Education, who's the administrator of our state Child Care Development Block Grant, has been working on for a number of years. With their initial PDG grant, as a part of the needs assessment and action plan, there were deliberate, intentional strategies to ensure that family childcare participated in those needs assessment processes and had seats at the table reserved for them in the work groups that were held. That then led to state legislation being passed in 2021 that actually directed the Department of Education to establish networks across the state. And then the Department of Education contracted with School Readiness Consulting to develop a frameworks document that will be shared with you as a follow-up resource. And then the Department of Education used that frameworks document to really put together the request for proposals that the Investment Corporation then responded to. But some critical things really informed that frameworks document, and these are things that any state or community can do, which is that there was a real investment in listening and learning directly from home-based childcare providers themselves, and very much aligned with the broad-based definition that Build and Homegrown is using. That wasn't just focused on licensed family childcare, that was really talking to what we call license exempt providers, so providers who are accepting subsidy but aren't required to be licensed in particular. And some of the key things that really came through in that are very much shaping this design. So some of the things that we heard people really wanted to be different in these networks is they wanted them to be relationship based, not mandatory. And that there's a real feeling that too often there's a mandatory feel and a punishment judgment feel to the resources and supports that are being offered to home-based childcare, and providers said, that's like, unless that changes, this is never going to succeed. So we are really building that into the DNA. They talked a lot in the feedback sessions about the need for safe and positive space. Actually hearing some of these things and reading them was it was very heartfelt and challenging to understand that even our best intentions, which many of us are operating under every day, aren't necessarily landing if we're not really listening and learning from the provider's direct experience and perspective. So lots of listening, lots of learning, bringing that into the framework. And then I think really capturing this opportunity with the availability of these ARPA funds to say, we know enough now and we need to move to action, because we're not going to be able to learn by doing more research and more talking. We actually need to do some designing and we need to do some piloting so that we can build our knowledge and understanding of what it actually takes and what kind of networks are really needed by doing the work itself. So I think that's another thing that states could take to heart, is a lot of times we spend so much money on our research and on our talking, but we don't spend enough actually on our designing and our piloting so that we get a different kind of knowledge. And that's one of the things that we're hoping to do with these initiatives.
Awesome. Thank you so much, Joan. I think really good advice, and we'll just underscore, because I have the opportunity to do it. I think we really see in all of our work that this works when providers are driving that process and when administrators are really designing with providers, leading and reflecting on what they need. And it's really awesome to hear how clearly the needs and desires of providers were able to come through in that process. So thank you so much, Joan. We're going to kind of shift to the next strategy area. Again, I think just kind of keeping in mind that the structure of a network may be an important leverage point for other initiatives. And now we're going to talk a little bit about the opportunity to leverage home visiting curricula to support the professional development and resource navigation for family, friend, and neighbor care providers. So we can go to the next slide. I'm just going to share a little bit of background. We talk a lot about home-based childcare as this broad group. I think just for a minute, we want to really hone in on this subset of home-based providers, which are family, friend, and neighbor providers. Again, this is a critical component of our childcare sector and is really the largest non-parental childcare option available to families. A huge number of children, over 11 million children, under the age of 13 are having their early childhood experiences in family, friend, and neighbor care. 1 in 4 children is being cared for by a grandparent. We know that families are selecting this option for lots of different reasons, including the desire to have linguistic and cultural match between the caregiver and the child. We know that in rural communities, again, this is a preferred and most used option. And we also know that for many families who work non-traditional or non-predictable hour schedules, this is the care that they not only use, but that they want to use, with paid and unpaid family, friend, and neighbor providers being far more available for that type of care. So this is a super critical group of caregivers. They're also a very challenging group of caregivers to reach, right? They often don't live on a list somewhere. We can't just call them up and say, what kind of services could we bring your way? And that's why there are some really creative programs around the country thinking about how to sort of address the needs of family, friend, and neighbor caregivers in much the way we address the needs of parents. So we can skip to the next slide. And, you know, really, there's a lot of opportunity around leveraging home-based childcare. There's a lot about the existing evidence base that, you know, we think is appropriate, but also the model of home visiting as kind of relationship-based, culturally based, often peer offered with individualized, you know, plans and support for resource navigation just lines up really well with who we understand the needs and desires of family, friend, and neighbor providers to be. And that there are currently 3 recognized national home visiting models that have an adaptation to support family, friend, and neighbor caregivers, including Parent Child Plus, Parents as Teachers, and HIPPY. So now I'm really excited to bring Heather Tritton into the conversation. And Heather's going to share a little bit about the work that her organization, Parent Possible, has been doing in the state of Colorado with that state's PDG grant. So Heather, can you share a little bit about what is going on or has been going on in Colorado?
Absolutely. I love your introduction because it really hit on a lot of the reasons we did what we did. In 2018, we did a pilot project with our PDG grant where we provided home visits to family child care providers. So we did both FFN and licensed care providers. So we weren't trying to suss them out, but we knew that that this was going to be an effective strategy because we already had some FFN providers who some of our sites started providing sort of regular home visits. And we did this with two of the models, Parents as Teachers and HIPPY. And what we did was we were like, okay, well, we have a lot of rural communities. We have a lot of home-based childcare happening in Colorado. How do we work with them to provide some sort of professional development that makes sense to them and that can reach them? And so as we put together the preschool development grant, we really had 3 goals for providing these services to family child care providers. So we wanted to improve school readiness of the children in their care by strengthening the caregiver and child interactions. We wanted to increase the home child care providers' knowledge, particularly of child development, and providing them with some skills for working with mixed age groups while we're trying to also deliver some school readiness supports. And then also trying to identify some model augmentations for both PAT and HIPPY to have effectively support providers and the families they serve. When we started this in 2018, both Parents as Teachers and HIPPY had, and they still do have, curriculum that was focused on family childcare providers. And, but they were both old. They were both trying to figure out, like, what is the next step? And so we also use this as a way to learn with our national networks, how can we do this better? And what works, what doesn't work? So this was really like it was a pilot for Colorado. In some ways it was pilot for the models as well, to kind of pull out that old curriculum and see how it's working. So we worked throughout Colorado. We had 5 sites in 6 counties, both rural and urban, where we partnered with our home visiting programs to deliver this augmented, adapted curriculum for family child care providers. We used staff that were already trained in the base PAT and HIPPY models. So mostly because we wanted to do this quickly, wanted to get going as soon as we had our PDG funds, which was good because then we had a pandemic. So we used people who were already familiar with the core program so that we could train them in sort of an adaptation and they could deliver to family child care providers. We did PAT visits monthly, just like we do in regular PAT. And HIPPY, we did visits twice monthly. And we had one site who actually provided an evening opportunity for providers to come in together because they wanted to see what it would be like to have that social network. So they actually delivered the program to a group of providers all at once, which turned out to be a very effective way to both deliver the program and build some strong networks. And so we delivered this program. The idea was to finish it up in June of 2020. So we sort of, we adapted it in the spring of 2020, but we finished it up and then we sort of stopped because it was the pandemic. And then there was also, we did a case study with the University of Denver to look at what some of our outcomes were. And so we wanted to take some time to really think about what do we want to change or what should this look like in the future?
Awesome. You know, I would just say, I think there are so few interventions to support family, friend, and neighbor caregivers. So we're so excited about the opportunity to leverage what's already known about home visiting, but also because family, friend, and neighbor providers are often isolated, they work long hours. This is a modality that is well suited to kind of meet their needs. Heather, I wonder if you could just kind of share a little bit, like as another state might consider this, you know, what are some of the things that you think, any advice you might give them, or what do you hope for your own state as kind of a next step for where this work might go in terms of, you know, either within the context of PDG or another context to really advance home visiting for family childcare, home-based childcare providers?
Yeah, I think we will be seeing more of this in Colorado. I think that there's a lot of momentum around it. And when I think about what are the things that we would do differently or how could it be more ideal, we know that this is a good strategy and that it's an effective way to reach FFN providers. We actually found providers through the families we were serving in our home visiting programs. And in Colorado, we actually have a system of state intermediaries for our home visiting programs. So we have organizations like mine that are nonprofits that sort of sit between our local providers and the state and the national offices. And being able to coordinate our work has been critical. So we work with the Department of Early Childhood here to say, how do we fund this? How do we create a system around it? Where do we fit within the FFN scope, right? Because that's not our typical work. We're typically working directly with families and really working to have a partnership where we can figure out how we can best support the providers that we're trying to serve. And so I would recommend writing it into your grant this time, but also really thinking about how do you connect with the families? That's one of the biggest challenges. How do you ensure that you are delivering in a way that meets them where they are, whether that's, you know, in their home in a rural area or bringing them together like one of our sites did, and really thinking about sustainable funding. So, you know, what happens after the PDG is done? How do we continue to provide these services? Because it is critical and we are reaching a population that is really hard and probably doesn't want to engage in some of the typical supports that I know we have here in Colorado that would support sort of licensed care providers. So those are the things that I would think about. I would say a lot more if I had more time, but some food for thought.
Yeah, that was super helpful, and I think really underscores some of the themes that Joan also listed. I think this piece around deep listening, leveraging these existing relationships to really define, you know, what implementation looks like. But then also, I think, you know, very wisely, both of you are thinking about how do opportunities like PDG or other funding opportunities really get embedded into systems so that they can be sustained for the long haul. And I think, you know, that is one of the reasons we're so excited about PDG, is because it really encourages states to, you know, start thinking about how does our entire system change so that this can be a part of our ongoing you know, offering to home-based childcare providers. Thank you so much, Heather. We're going to drop some of the awesome reports from the work in Colorado into the chat, and we're going to shift now to talk a little bit about the opportunity to incorporate home-based childcare providers into state-funded pre-K systems or publicly funded pre-K systems. So we can advance the slide. Maybe one more slide will advance as well. And I'm going to invite my colleague Alexandra to join me here. You know, we are really, when we think about opportunities to support home-based childcare providers, a lot of the way that we at Homegrown frame this is around how can we make existing systems more equitable and inclusive of home-based childcare. And so about a year and a half ago, we sort of, started really thinking about what does it look like to expand the inclusion of home-based childcare in the pre-K systems. At that time, we commissioned NEAR to just say, where is this even happening, And NEAR found that while there are many states where there are public pre-K systems, either in cities or in those states that allow family childcare to participate in their pre-K system, for the most part, they don't. There's not high percentages of participation. And when they are participating, they're participating as a very, very small share of those programs. So I think for all the places where we find family childcare providers in a state funded pre-K system, the percentage of their participation is very low. Sometimes, it's about 1%. So that tells us that there's an enormous opportunity to expand the inclusion of home-based childcare, specifically family childcare providers in pre-K systems, and that has significant benefits to the system itself, to diversify its workforce, to create more equitable access for families, but also has benefits to childcare programs who can benefit from the robust quality resources that are available within those systems. We can go to the next slide. And maybe here I'll kind of invite Alexandra to just sort of share, why should states be thinking about this? Maybe they've tried it, maybe they haven't tried it before, but why is this a really good idea for states to think about how to include family childcare in their pre-K system?
Absolutely. And I'll just share, this is a topic that's near and dear to my heart. I had the privilege of working in Philadelphia's pre-K system, and Philadelphia is a mixed delivery pre-K system that includes home-based childcare. So, I've had the opportunity to see it work really well. And, I think where we can continue to marshal the evidence and the research to really support equitable inclusion, it's really important to do so. I'm going to reiterate a theme that I heard in all of the previous presentations around equity. I think it was really a great way to start the webinar by thinking about what the prevalence of home-based childcare is in the country and how many families are really using that type of care. I think it's important for us to remember that preschoolers are already being served in home-based childcare settings. And so when we think about how do we make sure that those preschoolers are getting access to the same early learning experiences and resources that children in other pre-K settings are getting, I think it's an issue of equity. And so really, it's incumbent upon system administrators to really be thinking about creating pathways for home-based childcare providers to participate in pre-K systems. They're already serving families and preschoolers. And so how can we build a set of resources around them to ensure that they continue to do that work and continue to do it well? I think the other thing that really is a theme I heard in the other presentations is a theme around access. We know already the rich diversity of children and families being served in home-based childcare settings, those that are ethnically and linguistically diverse, families of children with special needs, families with mixed household status. And so bringing pre-K services to the setting of choice for those families is another way to create access for those families to pre-K services. I think the other thing that's really important, and we, as we work with both NEAR and Erickson, we really want to prioritize this message is that the home-based childcare workforce is deeply committed, and they are community anchors, and they are trusted partners with families in child rearing and caring for children. And so we want to compensate these caregivers, but also, highlight their strengths as we think about how do we create pathways of inclusion for them to participate in pre-K systems. I think the other theme I heard is about some of the geographic challenges of reaching children and families in different contexts. And so, leveraging and providing pre-K services in home-based childcare settings helps pre-K systems to really create some geographic diversity in terms of their service delivery and really connect with families who might be living in rural communities or families that might be living in other hard to reach communities. I think a couple of the other, Natalie, were you wanting to add something? Okay.
No, please go ahead, Alexandra.
I think a couple of the other ideas I just want to make sure to capture here is, it's important when we think about what are, the needs of children and families, that pre-K delivered to children in home-based childcare setting does have the opportunity to really respond to the wraparound needs of families. So for some families, the pre-K day, which is usually 5 hours, maybe 6 hours, sometimes less than that, doesn't work for the family in terms of their holistic set of needs. And so delivering pre-K in a home-based childcare setting allows not only for that family to receive the pre-K service, but also to access before and after care, even care on evening and weekends, particularly when we talk about the home-based childcare setting. So, when we think about home-based childcare, there are so many strengths in that setting type. And so really in creating pathways for home-based childcare providers to participate in pre-K systems allows the system to really build upon those strengths and reach families and children who may not otherwise be reached.
As often happens with Alexandra, I have to cut her off because I talk too much myself. So maybe we can go to the last slide, and Alexandra, if you'll just share kind of a final thought on the work that we're doing in partnership with NEAR and Erickson and their partners, and we'll drop the reports in the chat. But just a final thought on some of the resources that are coming online to support states and communities in thinking about this, and then you can turn it over to Annette.
Absolutely. So as Natalie talked about the genesis of this work, and it is ongoing. We're really pleased to continue to be working with NEAR, as well as the project team from Erickson Institute, the Equity Research Action Coalition at the Frank Porter Graham Center at the University of North Carolina and the University of Delaware, to continue to both understand the prevalence of inclusion of home-based providers in pre-K systems, but also to really build out a set of resources and tools to support pre-K administrators as they think about approaching mixed delivery. And so one of the briefs that the project team from Erickson, the University of North Carolina, and the University of Delaware just released is the brief, which really wraps around this conceptual framework that you see on this slide. And it was really developed with feedback from both pre-K administrators as well as home-based childcare providers who are delivering pre-K services. And so, it's responsive to the field itself, and it's informed by research about family childcare. And it outlines 5 really key implementation areas for successful inclusion of family childcare and pre-K systems. And they are equitable funding and compensation, accessible qualifications and professional development, streamlined data and monitoring requirements, comprehensive services for children and families, family childcare specific program quality standards, and family childcare specific program quality standards. And I think just 2 things I'll highlight about this framework that I think are really important. And I think the first is that it highlights the nature, the critical nature of alignment between early childhood systems. We know that family childcare providers do not operate in silos. And though they might be administering pre-K, they might also be administering Head Start, and they're participating in QIS, and they also are licensed, so they're going to have a monitoring visit. And so I think in order to ensure that family childcare providers can be successful in their delivery of these services, it's incumbent upon system administrators to really think about alignment and to take the 50,000-foot view about how do all of these program requirements and standards and sources of evidence and quality supports line up and really create some efficiency for the provider themselves, so that we're not actually taking away from the quality of service by layering on program requirements that don't connect to each other. I think the other piece that's really essential about this framework is that there is really a call for provider-led supportive infrastructure. And that's a theme that really emerged also when we were talking about the comprehensive networks. I think it applies here too. Any supports and resources and standards really need to be driven by the providers themselves, because they know their work, they understand what they need, and they should have a voice in both the decision-making of systems as well as the supports and resources that are available to them. So I will just highlight those things as really important call outs. And as Natalie shared, the links are in the chat, and we really encourage you to continue to explore them, especially as you think about PDG implementation. think Lynette, if you.
Yeah, I just was making sure I didn't
Okay.
talk over you, Alexandra. Thank you so much. And thank you, Natalie, and your team at Homegrown and the other panelists for really illuminating the possibilities of the inclusion of home-based childcare in the implementation of the PDG funding that is coming up, and the thoughtfulness of it. I think at Build, we're always thinking about centering the authentic voice of providers, making sure that whatever we're doing is responsive to the needs of family child care, and that there's co-building with the field when we're talking about systems and opportunities. And I think we heard that loud and clear with all the panelists, that all of the all of the examples that were brought definitely showed the listening and the centering of the genuine voice of family childcare, home-based childcare. And so I know that everybody is excited about this opportunity and working feverishly to meet this November 7th deadline. And so while we are not going to be able to give you much intensive TA around this, that we are definitely here to connect you with other resources as you're fine tuning your thoughts, because we know that with this deadline looming, you're probably only doing edits right now. But I know that Gina had some thoughts that she wanted to share, and Natalie has some resources and some opportunities for assisting folks that are writing their grants as well.
Sure. One note on this is that there is ongoing technical assistance. So to Lanet's point, that there is a grant deadline, but the submission of the grant, while we're very eager for family childcare to be well covered in those grant applications, when states receive the funds and they start implementing, there's going to be much more of heavy lifting. So making sure that folks, when you're at that point of really prioritizing and ensuring provider-led tables, provider voices, that ways in which to do that is something that we always want to make sure that we're offering technical assistance. And we know that many folks come to this webinar and maybe aren't aware of who Build is as an entity, or the other different great resources that are available in our field to support states and communities in working with home-based providers. Don't hesitate to reach out, and we will help connect you with other entities such as AOK and Homegrown and NAFCC. There's lots of other entities that are also working in the space, and we share different ways that we approach the work. And we would never want you to feel like if you reached out, we wouldn't help connect you with a resource that may be the most appropriate type of technical assistance. And so with that, Natalie, did you want to share a little bit about additional TA as well?
Sure. Thanks, Gina. I would just offer that we have a couple of consultants that are knowledgeable in these strategies and that can support you. Again, at this point, everything's pretty much light touch. But, are happy to, give you some thoughts and ideas on how to include this in an application, and are always excited to support states or other community leaders who want to implement these strategies. So I think I'll just drop an email address in the chat, but, really eager to help you and connect you to others, just as Gina said, if we can't help you ourselves. So thank you for the opportunity to share that invitation.
Thank you, everyone. This brings us to the end of our time together. It went so quickly. We have probably lots more to hear in the days to come. As we've mentioned in the chat, we are going to put together the PowerPoint with all the resources. There are many resources in the PowerPoint at the end that you haven't seen, with lots of links. So we're going to make sure that everything that was in the chat you receive, along with the recording and everyone's contact information. So if you have any questions, as Gina and Natalie both said, we all have different contacts with different areas of expertise, and we are more than happy to make the right connections. So there's no wrong door to knock on. We're all here for the same purpose. So thank you, everyone. As you exit, you're going to see a survey pop up. If you can take just 3 minutes to answer that, it really helps us tailor the sessions and information that we bring to you to what you want, and help us co-create it with you. So once again, we want to thank all of our wonderful panelists. Thank you so much, everyone. Natalie, Heather, Alexandra, Joan, thank you. And everyone have a great day.